I'm going to be your nurse today. I'm washing my hands. Okay. Can you say your first and last name and date of birth? While you do that, I'll look at your wristband.
Kundi Zenda, 02/29/2000.
Okay, perfect. And why are we in here today, Miss Kundi?
Just a checkup.
Just a checkup. Okay. Are you allergic to any medications?
No.
No. And are you in any pain today?
No.
No, no pain. Okay. And then, do you know where you are?
West Coast. Clinic.
West Coast. Perfect. And what day is it today?
It's the 25th of May.
Okay, perfect.
2023.
Perfect. Okay, so how's your mood today? How are you feeling today overall?
I feel good.
And the days prior, how have you felt?
I've been feeling good.
That's perfect. Okay, so I'm going to go ahead and get started with your physical. So it's going to be a head to toe. So I'm going to start with your scalp and go work my way down.
Okay.
Okay? So as I'm feeling for any bruises, scarring, or swelling in your scalp. You let me know if you have any pain as well.
Okay.
Okay. Did any of that hurt?
No.
And your scalp did feel symmetrical. I didn't feel any bruising or scarring or swelling or edemas, okay?
Mm-hmm.
So now I'm going to go ahead, and before I check your eyes, a nurse or your tech, prior to me coming in, did check your vital signs and everything looked normal. Okay. She also did your visual acuity exam, which is your Snellen's chart, and your vision was 20/20, which is perfect.
Okay.
Okay, so now I'm going to go ahead and assess cranial nerve number 3, which is your eyes, and I'm checking for perla. So what I'm going to do is I'm going to shine a light at your eyes, and you look straight ahead. Ready?
Mm-hmm.
Your pupils were round, reactive, symmetrical, and responsive.
Okay.
While I'm here, I'm also going to go ahead and assess cranial nerve 3, 4, and 6. So you're going to go ahead and look at the pen, and this is your 6 cardinal fields of gaze. You're going to follow the pen. Don't move your head. You'll just move your eyes with it. Ready? Okay, and your 6 cardinal fields of gaze look perfect. Now I'm going to go ahead and look in your ear, and I'm assessing for any signs of drainage or redness in your ear. Okay, no signs of drainage. Ears look fine, no redness. Okay, now go ahead and look up for me, and I'm assessing your nose for any drainage or deviated septum. Nose is intact and dry. Have you had any nose surgery in the past? No? Broken noses by any chance? No? Okay. Sorry. And I'm going to go ahead and look inside your mouth, and I'm looking at your tonsils. You're fine. I'm looking at your tonsils, and I'm assessing that your mouth is pink and moist, which it is, and tonsils look fine. Do you wear any dentures? No? Okay, perfect. Now I'm going to go ahead and have you look up, and I'm looking at your trachea to make sure it's midline, and it is. Go ahead and look to your left. I'm checking for your right JVD. No signs of JVD. Right? No signs of JVD on the left side either. Now, go ahead and swallow for me. Okay, perfect. That was cranial nerve number 10. Sorry, no, that was cranial nerve number 9. Go ahead and open your mouth for me. Okay, perfect. That was cranial nerve number 12. Now go ahead and stick out your tongue for me and move it side to side. That was cranial nerve number 12. All cranial nerve 9, 10, and 12 were intact. They all were perfectly normal. Now go ahead and shrug your shoulders up. Perfect. That was cranial nerve number 11, and 11 was fine. Now I'm going to go ahead and look at assess your nodes, or palpate your nodes. So this is your preocular, posterior auricular, occipital, retropharyngeal, submandibular, submental, interior cervical chain, posterior cervical chain, and supraclavicle. Perfect. Now I'm going to also assess your cranial nerve number 1. So what you're going to do is you're going to cover one nostril. You're going to close your eyes and you're going to tell me what you smell. And
Lavender.
good job. Now opposite.
Coffee.
Thank you. Now I'm also going to assess cranial nerve number 8, which is your ears. So what you're going to do is you're going to close your eyes. You're going to cover one ear. And on the opposite side, you're going to tell me what you hear.
Cats.
Okay, other side.
Dog.
Perfect. Now, go ahead and stand up for me. You're gonna close your eyes, and this is your Romberg's test.
Okay.
All right, perfect. No signs of swaying, so Romberg's test is fine. Now I'm going to assess your gait. So go ahead and walk that way. Go ahead and walk back. Your gait seems fine. It seems normal. Now go ahead and take a seat for me. Go ahead and put your hands on your lap and flip them as fast as you can. This is assessing for your upper motor function. Now go ahead and touch your heel to your chin. Heel to chin, not chin, I'm sorry. On both sides, that's your lower motor function. And that was perfectly fine. Okay. Now we can go ahead and move down. So I'm going to go ahead and assess your respiration and your heart. At this point, you would take off your shirt, but for the purpose of this video, we're keeping our shirt on, okay? So anytime you feel my stethoscope touch your chest, your back, you're gonna take a deep breath in, a deep breath out. Okay, so we're checking your posterior respirations first. Go ahead and lean with your, there you go, with your knees facing that way. And we're gonna move your hair to the side. And as I'm back here, I'm checking for your skin. I'm assessing for symmetry. I'm assessing that there is no lesions, bumps, or bruising, scarrings, and everything seems fine. Your skin looks symmetrical and intact. Breathe in. Perfect. Now go ahead and sit back with your knees this way. And you're gonna take a deep, you're gonna breathe in when you feel my stethoscope touch you as well.
I don't have an...
Okay, and now I'm going to assess your lateral. 1, 2, 3. And then 1, 2. Now, I'm going to go ahead and assess your heart rhythm. This is your aortic. This is your second intercostal right sternum border. Pulmonic. This is your second intercostal left sternum border. Erb's point, this is your third intercostal left sternum border. This is your tricuspid, which is your fourth intercostal left sternum border. And your mitral, which is your fifth intercostal left sternum border. And since we're in your cardiac, I'm also going to check your carotid pulse. And I'm going to compare it. First, I'm going to check them separately, and then I'm going to compare them to your radial pulse. Okay, so one at a time, of course. Okay, no signs of bounding pulses. Or Bruett's, I'm sorry. And your pulses are symmetrical. All right. Now we're gonna go ahead and, oh, I'm so sorry. While I assessed your respiratory and your heart rate, everything seemed normal. Breath sounds were normal, as well as your heart sounds. Normal rhythm. So I'm also gonna check for your pterigor, and it seems normal. Now I'm going to move down to your upper extremities. So go ahead and stretch your arms out and just follow my movements. And then go ahead and stretch them out one more time. And squeeze my fingers with both hands. Grip strength is normal and symmetric on both sides, okay? I'm also going to check for your temperature, which is warm to touch, and that is perfect. Let me see, I'm going to check your capillary refills, which is less than 3 seconds. And now we're gonna move down to your abdomen. So you're gonna go ahead and lay down for me. I'm assessing your stomach for any hernias, swelling, bruisingness, scarring, and nothing present. Your stomach does look normal. Now I'm going to go ahead and auscultate your bowel sounds or listen to them. Before I do that, when was the last time you had a bowel movement?
This morning.
This morning, and was it normal or
Yes.
was it abnormal? Okay. When was the last time you urinated?
This morning.
This morning. And was there any foul smell,
No.
color, or pain to it?
No.
No? Okay, perfect. And do you tend to have any UTIs?
No.
No? Okay, perfect. So for the purpose of the video, I will not listen to her bowel sounds for a minute each, but you would have to listen a minute each. So I'm starting with your right lower quadrant, left upper quadrant. I'm sorry, right upper quadrant, left upper quadrant, left lower quadrant. Your bowel sounds were active between 5 and 30 each quadrant. Now I'm going to go ahead and percuss and palpate. Before I do that, is there any pain that you have in your abdomen before?
No.
Okay, that I should know prior? No? Okay, so I'm just going to tap, tap, tap. Okay, now I'm going to apply light pressure. Okay. All right, everything seemed normal. Oh, don't stand up for me just yet, okay? Now we're moving down to your lower extremities. I am assessing for any swelling, edemas, scarring, bruising, or abnormalities. Everything seems fine. I am also assessing for temperature, okay? And now I'm assessing for range of motion. So go ahead and lift your leg up straight and down. This leg up straight and down. Perfect. I'm checking your posterior tibialis, dorsal pedis, and your capillary refills, which are less than 3 on each side, and no bounding pulses on your pulses. Go ahead and sit up for me now. And your lower extremities seemed normal. Now I'm going to assess your deep tendon reflexes. So, okay, go ahead and look away from me. All right, perfect. Your tendon reflexes seemed normal. It looks like we've concluded our head to toe. Is there any questions you have for me?
No.
Okay, so I'm going to go ahead and go document, and the doctor will be right in, okay?
Okay.
Thank you. And washing my hands before I leave.